If you're currently operating with nurse practitioners or physician assistants seeing patients while a physician supervises remotely, that model is done under these proposed rules. You'll need a physician physically in the building during all treatments.
3, 2, 1. Liftoff.
Welcome back to the Ketamine Startup Podcast. This is where we talk about how to start up a ketamine infusion clinic, how to market it, and more. We're always working to provide information that's relevant to those in the ketamine therapy industry or anyone interested in learning more about this field. And recently, we came across some significant developments that we felt needed immediate attention. On January 2nd, 2026, the Texas Medical Board published proposed regulations that could fundamentally change how ketamine therapy is delivered in the Lone Star State. These aren't just guidelines. If adopted, they would be mandatory requirements affecting everything from staffing models to business operations for any clinic providing parenteral ketamine for psychiatric conditions. But here's why this matters even if you're not in Texas. As the second most populous state, with one of the largest medical communities, Texas often serves as a bellwether for healthcare regulation. What happens in Texas may not stay in Texas. In today's episode, I'm going to break down these proposed rules, what they mean for Texas clinics, and why providers nationwide should be paying attention. I'll be covering the mandatory registration requirements, the on-site physician mandate, enhanced monitoring standards, and what this could signal for the future of ketamine therapy regulation. But before I dive in, a quick disclaimer. The information shared is for educational purposes only and represents our analysis of publicly available proposed regulations. This isn't legal advice, and all providers should consult with qualified attorneys and professionals and review the complete proposed rules directly from the Texas Medical Board before making any practice decisions. In our show notes, we've included a link that will take you directly to these proposed rules. Now let's dive in to these proposed changes and what that can mean for all of us. So let's start with the big picture here. The Texas Medical Board, as I said earlier, just published proposed regulations in the Texas Register that would create the first comprehensive regulatory framework specifically for ketamine therapy clinics in Texas. And when I say comprehensive, I really mean comprehensive. We're talking about mandatory clinic registration, on-site physician requirements, enhanced monitoring standards, complete ban on take-home parenteral ketamine, and enforcement mechanisms that put ketamine clinics on the same level of scrutiny as pain management clinics. Let's break this down on what actually is being proposed, because if you're operating in Texas, this could fundamentally change how you do business. First up is mandatory registration. Any medical practice providing parenteral ketamine, that's IV, IM, or subcutaneous, for psychiatric indications would need to register with the Texas Medical Board as what they're calling a psychotropic ketamine therapy clinic, or PKT clinic. This registration has to be filed by a physician owner or medical director. It's valid for 2 years, and here's the kicker. If your registration lapses, you must cease operation immediately. There's no grace period, there's no warning. Your registration expires, you must stop treating patients. Now, there are some exemptions, such as medical schools, hospitals, state and federal facilities, and board-certified health organizations under Section 162.001. Also, ketamine given for hospice patients is also exempt, given the palliative care context. But here's probably the biggest change, and this is where a lot of clinics are going to feel the impact. The proposed rules require that a delegated physician must be immediately available on-site for in-person consultation and emergency management through the PKT administration. And again, PKT is psychotropic ketamine therapy. Let me be clear about what this means. Having a physician on call but not physically present, that's not going to work anymore. Remote supervision via video? Nope. The physician must be physically present at the facility during treatments. If you're currently operating with nurse practitioners or physician assistants seeing patients while a physician supervises remotely, that model is done under these proposed rules. You'll need a physician physically in the building during all treatments. The training requirements are also getting a major upgrade. Physicians providing ketamine therapy must either have training in mental health treatments or completion of a course on ketamine for psychiatric conditions. And anyone administering ketamine, whether that's the physician, nurse practitioner, PA, or RN, must have formal airway management education or completion of a moderate sedation airway management course. The monitoring standards are essentially bringing ketamine therapy in line with procedural sedation protocols. We're talking about continuous monitoring of blood pressure, pulse, respiration, oxygen saturation, cardiovascular status, and responsiveness during treatment. Required equipment includes pulse oximetry, blood pressure monitoring, and end-tidal CO2 analyzers. For emergency preparedness, clinics need supplemental oxygen, bag valve masks, and AED or a defibrillator equipment on site. Post-treatment, there's a minimum of 30-minute observation period, at least 2 blood pressure readings 10 minutes apart, and a full cognitive assessment, including an Aldrate score, before patients can be discharged. Now, the documentation requirements are also going to be more extensive. Clinics need informed consent that includes both discussion of known risks, which is nothing new here, but now must also disclose the identity and licensure credentials of whoever is administering the treatment. So patients must know not only what could go wrong, but who exactly is providing their care. There's also a new timeout protocol required immediately before the administration, similar to what we are used to with surgical procedures. Clinics must also maintain an adverse event log for at least 3 years, documenting any airway intervention, EMS transport, hospitalization, or death. And they must review the Texas Prescription Monitoring Program when establishing care and quarterly for existing patients. Section 173.12 of the proposed rules is also clear, and I quote, "Any home use, prescribing, or administration of parenteral ketamine is prohibited," end quote. If you're currently providing any form of take-home parenteral ketamine in Texas, this new rule would shut down that model entirely. Perhaps most significantly, PKT clinics would be subject to the same audits, inspections, and investigation framework as a pain management clinic. This signals that the board views ketamine therapy with the same level of regulatory scrutiny as pain management. So what does this mean for Texas clinics? Let's be direct about this operational impact. If you're in Texas, these proposed rules would likely require significant changes. From a staffing perspective, if you're not already operating with a physician on site during treatments, you're looking at a major overhead increase. This could affect your entire cost structure. For equipment, if you're not using continuous end-tidal CO2 monitoring or don't have all the required emergency equipment, you will need to invest in upgrades and staff training. Also, the registration process itself creates new administrative hurdles. Applications are only valid for 180 days. So if you can't provide all the required documentation in that window, you have to start over. And renewal applications must be submitted at least 60 days before expiration. And if you miss that deadline, you must stop operations until you're re-registered. Now, here's why everyone, including those outside of Texas, should be paying attention. Texas is the second most populous state, with one of the largest medical communities in the country. When Texas establishes regulatory frameworks, other states' healthcare regulators are watching. If these rules take effect and appear to work, other state medical boards may take similar actions. We're seeing a broader trend toward formalizing ketamine therapy regulations, whether it's seeking insurance coverage, legitimacy, responding to high-profile cases with poor outcomes. The direction is toward more regulation, not less. These proposed regulations require a shift from ketamine therapy as an emerging, somewhat unregulated field to a more formalized medical specialty with specific standards. This professionalization has benefits: clear standards of care, enhanced patient safety, greater credibility, but it also has costs, such as high barrier to entry, increased operational complexity, and the potential reduction in innovative care models. These rules also force us to confront a fundamental question. Where do we draw the line between safety requirements and access to care? The on-site physician requirement is a perfect example. From a pure safety standpoint, it makes sense. We're always recommending having physicians on-site during treatments, but from an access standpoint, it does create barriers. On-site physicians make ketamine therapy more expensive to deliver. For clinics using nurse practitioners and physician assistants to keep costs manageable, this could force difficult decisions, such as raising prices, reduced treatment hours, or even potentially closing. This isn't a debate with easy answers, but it's a conversation we must have in every state. Another thing to consider is these rules would favor large clinics with physician partners who can be on site, well-capitalized practices that can absorb increased overhead, and hospital-based programs that have the resources to meet these requirements. It would challenge solo practitioners, small practices with nurse practitioners or physician assistants, clinics in rural areas with limited physician availability, and clinics relying on telemedicine or hybrid models. If this becomes the national template, we could see a consolidation in the ketamine therapy space. Now, these proposed rules are open for public comment until February 20, 2026 at 5 p.m. If you have concerns about implementation feasibility, specific provisions that would impact patient care, or suggestions for modification, this is your chance to weigh in. A public hearing will be held at a date to be determined, but written comments are due by that February deadline. So what should you do now? If you're in Texas, review your current operations against those proposed requirements. Calculate the financial impact of compliance starting now, even though these are still proposed rules. And consider connecting with other providers and consider submitting a coordinated feedback to the Texas Medical Board. Now, if you're outside of Texas, let's use this as a planning exercise. What would compliance look like if these similar rules were adopted in your state? Strengthen your clinical protocols regardless of regulatory requirements. Build relationship with state medical associations and regulatory bodies, because when regulations do come, you definitely want a seat at the table. And to close this out, some final thoughts. These proposed rules represent a significant moment for us in ketamine therapy. Whether you view them as necessary safety measures or access-limiting overregulation probably depends on how you currently operate. Our take, the truth is somewhere in the middle. We've always advocated for on-site physician and proper monitoring. From a pure safety standpoint, much of what Texas is proposing makes sense. But what about these unintended consequences? Will these requirements price out patients who desperately need care? Will they force quality providers out of the market? Will they create a two-tiered system where only wealthy patients in urban areas can access treatment? What we know for certain is this. The era of unregulated ketamine therapy is ending. The question isn't whether we'll have rules. It's what those rules will look like and whether they'll strike the right balance between safety and access. Texas is trying their hand at this first comprehensive answer. The rest of us should be paying very close attention. Thanks for tuning in to this special episode covering the Texas Medical Board's proposed ketamine therapy regulations. If you found this helpful, we'd really appreciate it if you could leave us a review on Apple Podcasts or Spotify. It helps other entrepreneurial medical professionals discover these important industry updates. For complete show notes, links to the full proposed regulations, and our detailed blog analysis, visit www.ketaminestartup.com/podcast. We'll also be monitoring the situation and will provide updates as the public comment period progresses and final rules are adopted or not. Remember, this episode is for educational purposes only and doesn't constitute legal or medical advice. Always consult with qualified professionals regarding regulatory requirements specific to your state and practice situation. Thanks for listening, and we'll see you in the next episode.